Hello, my name is Corinthians, and today I'll be doing my disease report over syphilis. I do want to give a disclaimer that a lot of these images in this presentation are very graphic. I'll give another disclaimer as we get closer to those images, but yeah, this is just a little warning. Okay, so let's begin with the infectious agent of syphilis. It's going to be called the Treponema pallidum, and it's a bacteria, gram-negative, microaerophilic, s- spirochete, and motile, and this is due to the endoflagella that's in the inner and outer membranes of this bacteria. And then furthering with the nomenclature, Treponema, the genus, is it's derived from the Greek word trepo, which is to rotate or turn, and most of the bacteria in this genus have the same spiral type form. And then the term syphilis, it comes from an Italian poem called the Syphilis Sive Morbis Gallus, and it's just translated into it's translated to syphilis or the French disease, and it's basically about a man named Syphilis, and he insulted Apollo, and Apollo retaliated by introducing a disease into his town, and he was the very first victim. So yeah, it's a very sad poem, but anyway, moving on to a nickname for syphilis, it's also called the Great Imitator because a lot of the manifestations, like on the skin, it actually it gives rise to a lot of other differential diagnoses, like genital herpes or Rocky Mountain spotted fever or even lymphoma. It just depends on the symptoms. The taxonomy of syphilis, this slide is for Dr. Cody, but if you really wish to look through the taxonomy, then you're able to pause and do as you wish. So related pathogens. I'm sorry, I redid this video so many times. T. pallidum is actually the only agent in the Treponema genus that causes venereal disease. And if you don't know what venereal disease is, it's basically an STD. There's other non-venereal diseases in this genus, and it's the Treponema pertinue or yaws, and Treponema keratium, and that's pinta. Yaws is basically lesions that form on the skin, and they kind of go deeper into. They go past the skin, and they can affect the joints or the bones. And you can see in this picture down here, you see like the deformity of the bones. So they're just lesions, very large lesions, very painful and and uncomfortable. And then up here we see pinta, which is like the hardening, different rashes and hardening of the skin, just very dark discoloration. Yeah, also very painful. Pathogenesis. So T. pallidum is actually a very slow metabolizing bacterium and requires about 30 hours to replicate. And like mechanisms for invasion include like an adhesion to the epithelial cells. Basically, T. pallidum would bind to the fibronectin on host cells. Um, Also, very a side note, T. pallidum is only like in humans. There's no other type of reservoir for them. It's only human reservoirs. It's not in animals to humans, not in any non-living reservoirs, just humans. So when I say host receptors, just us. So it has an abundance of lipoproteins that are located below the cell membrane, actually below the cytoplasmic surface. So this gives the bacteria an advantage to hide from the immune system. And it brings me to the last point, like the lack of PAMPs on the surface. Like there's really not any not bacteria, not really any proteins. Like it's not an abundance of proteins on the surface, and they can kind of change the proteins if there are any on the surface, which makes it even harder for the immune system to find it. So what is syphilis? It's an acute and chronic STD if it's left untreated, and the site of infection is through like the genitalia during sexual intercourse, contact with an infected person like vaginal contact, anal genital contact, oral genital contact, and that's if they have lesions there. Lesions on their skin as well. It can be spread by direct contact with other skin lesions. It does not have to be on genitalia. Someone has a skin lesion on their arm and they have syphilis. Okay, okay, I'm back. So yeah, the next slide is going to be very graphic. Please brace yourselves. All right, so we're gonna get into the stages of syphilis. There's three main stages, but the very last one, I didn't include that in here. It's the latent phase, and it's basically when the disease goes dormant into your body. So there's a very wide window of incubation period. So from 10 to 7 days, with like the median being around 20 days. Um, Once you get a lesion, it can probably last for about 2 to 3 weeks, honestly. The body will heal on its own, which is why a lot of people don't realize that they have syphilis. But it usually begins with a canker sore, canker ulcer. Most of the time, it's painless. Like I said, painful earlier, but most of the time, it's painless. This is why a lot of women, when they have syphilis, they have sores or ulcers on their cervix and they do not feel them. And that's very interesting. But this looks pretty painful to me. Um, this is an ulcer right here at the top, but you can also see one that's probably healed up or something. Yeah, it's going away. And then we have secondary syphilis with the macular or papular rashes that affect the palms and the soles of the hands. You can see that secondary syphilis right here on his hands, right here, but also having some like acute primary stage syphilis ulcer on his. Anyway, raised warts like lesions known as condyle condylomata lata, and that's what you see here. Um, from the literature that I've read, it says that it's painless, but it looks pretty painful to me. I'm not gonna lie. Next, tertiary syphilis, gumma or guma. These are also just another form of ulcers that are on the skin, but it can involve the bones and the visceral tissue as well. And then we have cardiovascular lesions that can cause aortitis or the inflammation of the aorta, the aortic aneurysms, and lead to like aortic valve disease. And then we have neurosyphilis, which is inflammations of the small arteries to the brain, which can cause meningovascular syphilis. It's just another word for neurosyphilis. And if that's not treated, you can get a stroke in like 5 to 10 years. So a lot of people really do not know that they have syphilis. They know that something's going on, but they probably don't have like direct access to healthcare. But then we have congenital syphilis, which are babies born to women with untreated syphilis, once again, from that lack of healthcare, usually result in this bullous rash on the palms of their hands or the soles of their feet. You can see that here. It looks so sad. But yeah, kids normally have anemia in the future, or not in the future, but as they get older, and then they have limb pain because these lesions they go into their joints. It's all very sad. It's very sad. So the immune response, innate immunity. We have the neutrophils. They're the first to go to the infection site. You have that cut or something on your arm, or you get it through the genitals, creating that inflammatory response. And then we have the dendritic cells that go in and try to phagocytize really quickly early on in the infection and go right to the lymph nodes. I excluded the cellular immunity from this presentation, but you know that the T cells are very active immediately trying to phagocytize these bacteria. But I really thought it was interesting that there's a subset of B cells in the humoral immunity that secrete antibodies. They're called B1 cells, and they bind to the cardiolipin that reside in the membrane of the mitochondria of this bacteria. And it seems like the body seems to recognize that and go ahead and try to opsonize them so they can get phagocytized. Diagnosis: the T. pallidum is detected immediately by microscopic dark field examination, but that's not really done unless it's like research going on. So we see a lot of nucleic acid amplification or like PCR testing to like generate that to prove go ahead and prove and generate that okay, yeah, you have syphilis. And then we have some other staining techniques like silver impregnate I'm sorry, I cannot say that word. Some techniques like the Warthin Starry stain, Steiner stain, Lavediti stain. Incidence and prevalence. So the highest incidences are in low and middle income countries, and they like have like 60% of the new diagnoses come from them. Sub-Saharan African, Africa, excuse me, Southeast Asia, Latin America, Caribbean. And then we have a large increase of cases in the US, about 38% increase from 2008 to 2012, and then 80% increase from 2018 to 2022. With, I think in 2018 it was like 88,000, and then we could jump to 2022 with about 200,000 cases. So yeah, we see a very large increase there. And then the main groups of people at risk are men who have sex with men, and then individuals with HIV, just because they're immunocompromised and it's easier for them to get different types of STIs or STDs. So historical perspective. So to this day, it's kind of there are like debates all over the place regarding the origin of syphilis, but the Columbian hypothesis really just says that maybe Christopher Columbus and his crew brought it over to Europe, but then that has been debunked in the past couple of years with the pre-Columbian hypothesis, with like a lot of cemeteries being dug up from the old world, seeing the bones in the feet, or the in the lower leg and the feet, with the non-venereal diseases, the from like yaws or pinta, just those diseases being manifested in the skeleton bones. And there's also been some type of other hypothesis saying that syphilis is just a mutation of those non-venereal diseases. But yes, we know that there's treatment discovered in 1948 by Alexander Fleming. He created penicillin, and it's still used to this day. But there are different alternatives for individuals who are like allergic to it, like doxycycline or azithromycin. So here's another aspect of history that I wanted to mention. I actually watched this movie in high school, like when I was about 17. But the Tuskegee syphilis study is just a study between 1932 and 1971. The U.S. Public Health Service, um, they recruited about 400 African American men, and they were subjects to evaluate untreated syphilis. And they knew what they were going into, but they were under the impression that they were going to receive treatment. None of them received any treatment after the course of 6 months. Very sad movie. Lawrence Fishburne, he was in the movie we watched for Lab. I forgot the name, but y'all know what movie I'm talking about. Very, very sad movie. Yeah, if you want to ever watch it, it really just shows you what went on um during that time. Very sad. Future outlook. So there hasn't been a vaccine yet, but there's been some progress on trying to like create one. There's been some testing on rabbits with gamma irradiated ir, gamma irradiated T. pallidum, which provides some protection from other subspecies of T. pallidum, but it's not very consistent. But yeah, the main reasons we want this vaccine is one, for pregnant women, because there's been a rise in cases of congenital syphilis, and we just want to kind of go ahead and um try to eliminate that if we can, and make sure that it's inexpensive to produce, because most of these cases are in the um lower like developing countries. And then just to make sure there's no adverse health effects, like like we want for any type of vaccine. Thank you guys for watching. I hope you learned something just like I learned something. Sorry that I was talking really fast. I kept running into 15 minutes